Let's continue with more MCQs on chronic suppurative otitis media. Question 21. What is the primary cause of CSOM in developing countries? A. Genetic factors. B. Poor hygiene. C. Untreated acute otitis media. D. Excessive ear cleaning. The correct answer is C. Untreated acute otitis media. Question 22. Which type of ear discharge is commonly seen in CSOM? A. Serous. B. Mucoid. C. Purulent. D. Bloody. The correct answer is C. Purulent. Question 23. The most effective method to prevent complications in CSOM is A. Regular ear cleaning. B. Early diagnosis and treatment. C. Use of ear plugs. D. Avoiding swimming. The correct answer is B. Early diagnosis and treatment. Question 24. Which of the following is a common sign of cholesteatoma in CSOM? A. Pulsatile tinnitus. B. Dizziness. C. Foul-smelling discharge. D. Ear pain. The correct answer is C. Foul-smelling discharge. Question 25. CSOM primarily affects which age group? A. Infants. B. Adolescents. C. Adults. D. All age groups. The correct answer is D. All age groups. Question 26. In CSOM, the tympanic membrane perforation is usually a self-healing. B. Persistent. C. Transient. D. Rare. The correct answer is B. Persistent. Question 27. Which imaging is essential before surgery for CSOM with suspected complications? A. MRI. B. Ultrasound. C. X-ray. D. CT scan. The correct answer is D. CT scan. Question 28. Which of the following is a typical presentation of a patient with CSOM? Sudden onset of symptoms. B. Gradual worsening of hearing. C. No visible ear discharge. D. Normal hearing. The correct answer is B. Gradual worsening of hearing. Question 29. A common feature distinguishing CSOM from acute otitis media is A. Acute ear pain. B. Presence of fever. C. Persistent ear discharge. D. Recent cold symptoms. The correct answer is C. Persistent ear discharge. Question 30. The initial assessment for a suspected case of CSOM includes A. Blood tests. B. Tympanometry. C. Otoscopic examination. D. Hearing aid trial. The correct answer is C. Otoscopic examination. These questions help further understand SOM's presentation, complications, and management. Essential knowledge for ENT practice.